I personally did to get a 40-point increase from step 1 to step 2. Hey everyone, this is Nick. I'm a PGY3 neurology resident. Today I wanted to talk about step 1 and step 2. I wanted to make a video for anyone out there that may have had a hard time on step 1, how they can improve on step 2, and what I personally did to get a 40-point increase from step 1 to step 2. So I remember when I got my step 1 score, I was in the car with my wife. The score report came out. I clicked it. It wasn't going to be like the best score that I had wanted, but I was really disappointed with what the result was. From that moment on, I knew that if I wanted to match into a program that was geographically ideal for me and my wife, and just a program that I wanted to be at, I would have to really make some changes for step 2. Treat each rotation individually. So if you're on surgery first, if you're on peds, if you're on OB, really go through all the UWorld blocks on that multiple times. Dedicate that month to, I'm going to study this so that I'm ready for step 2 with this material. I think that was really helpful for me, because when it became time for dedicated study, I had already gone over all the material at least once, and I knew it well because I was studying specifically for the shelf exams. Doing the NBME shelf exam practice tests was very helpful as well, because these are just like step 2 questions. Another tip that's super important is when you're in your third year of med school and you're on these rotations and you're seeing things firsthand and you're watching, I think it's so much easier to retain that information because you're doing it firsthand. You're in the clinic, you see that patient. So I would encourage you that when you have patients, really read up on them and be able to see that pathology, and come test day, you're like, oh my gosh, I remember this patient that I saw, and this is what we did, and this was the treatment plan. I think that's one of the cool things about step 2 versus step 1 is a lot of it is just, it's clinical management, how you're treating the patient. To me, that was much easier. I don't know if that's how it is for other people, but I think in and of itself, step 2 was an easier test for me because it was less memorization and more of how can I help this patient? What can I do? Whenever I had a shelf, I would do the URL blocks, I would do the podcasts, and then before the test day, I would have done all of the NBME shelf tests. And I know they can add up. I think they're like $15 each. I'm not sure if it changed. I don't really remember, but I think it's worth it in the end. I think it will really help your step 2 score. Honestly, I think this was one of the most important and most helpful things was I listened to the Divine Intervention podcasts. He has now, I think it's in the 200-300s podcasts on step 2 material and even step 1 material that's really helpful. Divine's podcasts were a big part of how I did much better on step 2 versus step 1. Just listening to his shelf review, his high yield podcasts. Before every shelf, I would make sure I listened to the podcasts related to that specific shelf. So for OB, I would listen to all the OB podcasts. Come test day, listening to all those podcasts, I was able to remember things, and it would just kind of pop in my head, and it was a great feeling. So I would really encourage you to listen to Divine's podcasts. You can find them on Spotify, and you can find them on YouTube, and probably Apple Podcasts as well. And he also has his website. Trust your NBME scores. I know it's step 1. I wasn't getting the NBME scores that I wanted. And I kind of was like, you know what, on test day, it's going to be different. That's a silly mistake I made there. To be honest, it was pretty accurate. So I would recommend that you trust those scores and you don't take step 2 until you feel fully prepared. And the scores that you're getting on your practice tests are lining up to what you want and what field you want to match into. Don't get overwhelmed with resources. I know when I was studying for step 1, everyone was like, don't get overwhelmed. Don't do too many resources. You have Pathoma, you have UWorld, you have Amboss, you have all these different things. And I think that's actually really true. So for me, I realized I was more of a auditory learner. I did better when I would go on walks and listen to the podcast. That's what helped me retain the info. So I think find your 2 or 3 key resources and stick with them. it can be really tempting to want to use a bunch of different resources. Thank you guys for watching. Please drop in the comments anything you did to improve on step 2.